Hello, this is Dr. Kelly, and this is Equitable Healthcare. Today, we'll be talking about long COVID and how to achieve equity in healthcare for long COVID. For my patients, when I was treating COVID in the summer of 2021, I noticed patients who were having what I called at that time lingering symptoms and And ultimately, within weeks, the term that was fleshed out in the medical community was long COVID. These patients took more than 3 to 5 days for their symptoms to resolve and more than 6 to 12 hours for fevers to resolve. Eventually, I would encourage these patients to go to a long COVID center. Some patients I would treat again. Just this was after 2 to 3 months. I would begin again in my treatment protocol. Most patients who went through a second stint of the treatment regimen normally did well and reported that 98 to 99% of their symptoms were cleared up. One of the issues with long COVID is we have to accept that there is a viral reservoir in, I guess, places with high density lymphoid tissue, the gut, the neck, the brain with its own, immune system, and to understand that maybe there is a low level of viron regeneration going on in these areas, and that's a component of the long COVID, which is also causing dysautonomia, diabetes, the chronic fatigue syndrome, uncontrolled hypertension, and these systemic disease sequelae. At the current, right now in the medical field, there are about 3 to 4 treatments along COVID. I use ivermectin and doxycycline, or ivermectin alone or doxycycline alone, but I do a lot of preventive medicine. So for me, you have to do reflexology, you have to do chest physiotherapy, you have to really work on yourself to clear the virus and the viron components from your lymphatic system. The other treatment modalities right now are immune infusions. They have COVID infusions. There is medical cannabis. I use medical cannabis as a medicinal therapeutic as well. And there is low dose naltrexone. And for patient to understand that it's a lot of work, it's a lot of denuding of the myelin sheath that's causing a lot of the dysautonomia and the infection of this low-lying replication of the COVID virus in the body, still infecting neurons and the synapses. And so it takes time to clear this viral load, which normally you need high B complex to do, selenium, magnesium, a good, what I call a potent multivitamin. And it's just a lot of work with reflexology, chest physiotherapy, acupuncture, foot detox, ionic spas. It's just a lot of work. And it's going to take about a minimum of 6 to 12 months, maybe 2 years of consistent maintenance therapy to clear as much of the virus and the virons and its particles from the body, so that the person can feel as if they're a functional part of society again and do the things they like to do. They may not be able to do a 10-mile run, but at least a 3 mile run, you know, and to really educate patients about their expectations relative to their disabilities and the current limitations to still function at a level where they feel as if they're still a valuable part of society. To approach this preventive medicine, this global preventive medicine approach to long COVID treatment, you can make a consult with me in the drop down box at www.veritasplanetree.com, and we will do your best to get you on the road to feeling like a human being again and getting you to a level of functionality where you still feel like you're a valuable member of society. Thanks so much. This is Dr. Natasha Kelly for Equitable Healthcare. Shalom.